Utah State University Extension, and I'm so excited to introduce a new Extension agent here with me today. I have Ashley Yaugher. Ashley, will you just take a moment and introduce yourself? Let us know where you live, where you're from, and maybe some fun things that you like to do.
Thank you. Yeah. Hello. Good morning, everyone. I am Ashley. I am a Heart faculty, the Health Extension Advocacy Research and Teaching Initiative faculty,
That's kind of a mouthful.
It's kind of a mouthful. It started a while ago. It's been a few years, almost 4 now. It'll be 4 in July that we've been going. And I'm also a health and wellness faculty, so that's my general title. And it's like a big mouthful.
That's why we have the acronym HEART.
HEART, yes. It's so much easier to just say.
Yeah.
And I serve Carbon and Emery counties, so that's where I live, in Carbon County, and just love being out here in rural Utah. And you said, where am I from?
Yeah, where are you
Originally?
from?
I've been all over the place. I'm like, how do I say this quickly? I'm from California originally, but I did my graduate work in Texas. So I lived there for 6 years, and now I've been in Utah for 5.
Did you ever imagine you'd end up in rural Utah?
No, no, I didn't, but I am glad that I found it. I think it was just happy coincidence that we ended up here.
Yeah. Yeah, that would be a big change to move somewhere rural. But you like it for your family?
I do, and I grew up in a rural part of California. People don't think of rural California, but there are rural parts where there are small places, and it's kind of far away from everything. It's very similar, actually, to Price, where I live now.
Oh.
So that's actually kind of nice to get back to something that feels like home.
Yeah. Yeah. Well, that's great. It's funny. I just talked with Ro Zwalin last week, and he's also, he doesn't work in Price, but he lives in Price and is from Price. So it's fun to meet all you agents from different parts of the state, for sure.
Yeah, we're everywhere.
Do you want to tell us anything else, about you personally or family, or what things you like to do?
I like to do a lot of things. The past couple years have really cramped my style of doing things with people. I'm a people person. I like to get out there and do stuff with friends and collaborators and have in-person events. So I'm really excited that those are back and getting launched again. And other things I like to hike. And
you live in a good part of the state to do that?
Yes, hiking and exploring just in general. There's so much fun stuff to explore. We have 9 Mile Canyon down here and the Wedge and lots of things that are really close to Price. I think people drive quickly through Price to get to Moab and like other places on their way, but there's a lot of really cool stuff in this little city. And so it makes it a lot of fun for me. And my family. I just had a baby last year, and that's been fun.
We were just talking about this before we went live. We were bonding over our pandemic baby experiences.
It was a unique experience. I think although a lot of us have had it, apparently. I didn't even know. Yeah.
Well, it seems like everyone either had a baby or got a puppy, right? Or started making sourdough. One of those 3.
Yep. Probably have their starters ready.
Yes, that's right. Oh, that's great. So tell me about, you mentioned you went to Texas for school, right?
Mm-hmm.
What did you study when you went to school?
Yeah, so I went to Texas A&M University, which was really fun and also very different than California or Utah. So that was a great experience. I studied psychology when I was there. So my master's and my Ph.D. are in clinical psychology. And so that was a really great experience and opportunity to get that training and in-depth knowledge. I say health and wellness, but my primary passions really are mental health and wellness. And so all things mental health are things that I have a really strong background in and I enjoy doing.
Yeah. And did you imagine that you would become like a therapist when you were doing those things? Or how did you end up working at Extension? Did you want to teach?
Yes. So I have always had a love of teaching. I have taught undergraduate classes, so the kind of traditional thing people think of with professors and teaching.
Yeah.
And then, I found this opportunity when it came out, when the HEART initiative launched in 2018 of July. And I saw it and was like, oh my gosh, that's like a perfect intersection with what I'm interested in because it combines the teaching as well as reaching the community. So
Yeah.
Extension's such a great fit with getting that information out into the community to people who need it. And so instead of that traditional classroom model, you teach the community. And so that was something that was really unique. And I had never heard of Extension before, which is
You were not a 4-H person?
I wasn't. No, I had never heard. I knew about FFA and other
Yeah.
things, but not ever like any direct experience with Extension and just the opportunity to reach right into people's homes. And Extension is such a great place that is established, and people know that we have trusted information about evidence-based topics like gardening and agriculture, but adding this mental health and wellness component was really, really cool and innovative. And I think we were one of the first states actually to launch health and wellness, but specifically opioid prevention. And so that's something that I just was very passionate about. So it fit really perfectly with, and I never imagined myself to be a full-time therapist. Your other question. So I just really was interested in giving people information and teaching and working with collaborators in the community to make a difference. So that's kind of what I really liked. But yeah, it was like a perfect fit.
Oh, that's great.
It was a surprise.
Do you want to talk a little bit more about the Heart Initiative and what it is? It's relatively new. And you mentioned a few things about it with, the opioid epidemic and some of the mental health things that your team works on. But tell us a little bit more and maybe kind of what parts of the project you're involved with.
Yeah, that's a big question. Like, so we started in 2018, right? I've said that a couple times. That's when I started. So I got to join the program and Extension and do all of these things at the same time. And Heart, I'm just going to keep saying Heart because I already said the long acronym.
It's too long to say.
It's too long to say again. But we really started as a pilot initiative, and we're initially a 4-year initiative, but now we have extended past that 4 years, which is great. And we really seek to collaborate with our different communities to address the opioid overdose crisis, but also other public health concerns. Yeah. So some other things that people have done in the Heart Initiative, and now we've also expanded beyond our first 5 faculty. So now we're having more and more faculty join us from across the state. So it's really growing and it's sustainable, this model, which is really exciting to be more collaborative and have a broader reach. But other things that people have been doing are things like combining mental health topics and suicide prevention with this substance use prevention because they often go hand in hand. And also some other stuff that we've done is like vape and tobacco prevention, some of those more gateway type substances that youth get involved with and that can lead to then other substance use disorders, right? And so we have a really unique opportunity to collaborate with our agencies in the community and other extension faculty and professionals across the board, law enforcement, right? All the people who have boots on the ground, mental health professionals, health departments. And so we try to bring our unique academic resources into the communities that we serve because that is our contribution, is that evidence-based information and trying to serve our communities. And it's been really, really rewarding. And I think it's fun, right? You can do some really difficult topics and programming and still have a lot of fun. And so the past 4 years has gone so fast because it's been, I think, really enjoyable to work with our different communities. And gosh, I mentioned a few things, but we have 4 main pillars of Heart. So one is stigma and harm reduction, and that's primarily where I do most of my work, is in stigma reduction and kind of education on mental health topics. And then we have strengthening community ties, which we really try to bolster and strengthen our communities. And I started a Carbon and Emory Opioid and Substance Use Coalition to help bring us all together and talk about things collaboratively in my communities. And
that's so important because, I mean, I'm not an expert in the opioid epidemic, but, you know, I've heard news stories here and there, and it is a problem in rural America. It's not just something that's in big cities. It's plaguing our rural communities as well.
Yeah, I think it actually hits rural communities even harder in most places. And so it's been really great to make a difference and to reduce some of those overdose deaths collaboratively, right, with everybody else doing the great work. And we think rural areas have no resources, but really they have so much to offer and so many people doing good work and passionate work because people really do care. And everybody knows everybody. So it's hard not to care when you know people.
People who live in rural areas love those places. That's what drives them to stay, right? They care about their community.
Exactly. Yeah. Yeah. And that's, our second pillar was strengthening community ties was something that was really important to bring us together. And then we have prevention and education and resilience building, which all four of those really combine to make a strong initiative approach.
Oh, that's fantastic. Well, that was not a question I prepared you for, so I appreciate you just giving that little overview about the Heart Initiative, because I think you're doing such important work, and I want more people to know about the things that your team is doing. I'll get back to my scripted questions now.
Oh, you're fine. This is fun.
What is your favorite part of your job so far?
So far, right? Yeah, it changes. I guess it's changed over time too, but some of my favorite parts, I mentioned the Carbon and Emory Opioid and Substance Use Coalition. That's really my favorite part of my job, is working with the community and bringing people together on the same topics and sharing and getting that information out to the people that need it. That's my favorite part, is collaborating with other agencies, other faculty. I just really enjoy that connection. And I think that's definitely been my favorite part, even though, right, we're rural, we're kind of all far apart sometimes in extension and other agencies. I think that's one highlight and maybe a strength that COVID-19 showed us, is that we can all still be together even if we're far away. Like right now, right? We're not in the same place. And so just bringing people together has been really, really great.
Oh, I love that. And quickly, if folks in your area want to get involved, are they able to participate in the coalition or see outcomes from the coalition, or what plan of action could people take?
Absolutely, yes. It's a completely open coalition. We are always looking for new agencies, community members, anybody who wants to get involved. They can just email me at my email, and we'll put it in there, right? So ashley.yaugher@usu.edu. And people can totally just reach out to me or call me, and I will add them. We have a mailing list. We're like really big time, and now we've got a mailing list, and we meet every month on the first Monday for an hour at 11 a.m. And so that's something that we've been doing now for the past several years. I think we're 3 years and running. And some of our big impacts, we make a local resource recovery booklet, and that's on the Heart website. So anything that we store online, I try to put on the Heart website because it's easy to find. If people know where it is, it's a trusted resource. And that's extension.usu.edu/heart. And so people can visit that and see that booklet, as well as more information about the coalition. And if people want to join, we're doing actually this month. Today is April 1st.
So Monday is your first meeting, right?
Monday's our first meeting.
But the meeting for April.
Yes, the meeting for April. But we are doing a coalition Take Back Day. The National Prescription Take Back Day is in April on the 30th this month.
Oh, that's fantastic.
So, law enforcement and coalitions throughout the state are coming together to provide that opportunity for people to take back any old, unused medications. And I strongly encourage anybody who has anything in their medicine cabinet to go take them back on April 30th. Also, vape devices, they'll take those too.
Great. That's fantastic. And the links that Ashley's mentioned, I will share in the comments as soon as we're done, as well as her contact information for those of you who are interested. We do have a comment. Arvin is watching from Elmo, Utah. Welcome, Arvin. Thanks for watching. And it says, happy April 1st. It is officially springtime. Yes. I haven't been pranked yet today, so I feel lucky because I have a 9-year-old and a 6-year-old, so I don't think they know that it's April Fools. Um, okay. One last question, and maybe you've touched on this a little bit already, but what are the kinds of things that you're helping people with personally? Not personally, but like on an individual basis in your county?
In our count, and so I serve Carbon and Emory, and so some of the things that I think have been really helpful for individuals are those resource recovery booklets. We have a lot, like I mentioned, a lot to offer in small areas, but it's hard to find what is available and where it is. And so we try to get funding to print those resource booklets and give them to anybody and everybody who has a family member, a loved one, or themselves are experiencing substance use disorder or are in recovery or want to learn more about different pathways to recovery. And so getting that into people's hands has been really meaningful.
Yeah.
And so I think that's kind of one of the biggest ways that I've helped the individuals in our county.
Yeah.
And I just am open to helping any way that I can in other ways too.
Yeah.
And so I try to partner with my local agencies and other extension faculty to bring awareness to their stuff too, because health and wellness is not just one thing. It's so many different things that make up who we are. So really it takes a village.
Right. And I would imagine that folks who are in those situations where maybe they have a loved one who is struggling with addiction may not know where to turn, especially in rural areas where they might feel a little more isolated or, things like that. And I'm so thankful that we can share some of the work that you've been doing and share these resources so that people know where they can go for help and resources to learn more and get help. So I think this has been great.
If people aren't in Carbon and Emory, right, and don't have that resource book, Utah 211 also is a good resource in Utah, and they have a whole list of substance use resources and mental health resources that people can find online.
Okay. All right. Oh, we have a question. Mary Beth says, what are the rates of substance abuse in your two counties compared to Utah or Salt Lake counties? That's a really good question. Is that something you know? Or maybe if you don't know, we can look it up later.
No, that is something I know. Unfortunately, Carbon and Emory are leading the state. We are per 100,000, much higher than other counties and other small areas throughout the state. So kind of Carbon and Emory are number one in the state for opioid overdose deaths and substance use deaths, as well as suicide deaths. I think the past couple years, things have been going up in different places as well. So I know Ogden has also experienced some higher rates. And we do have heart faculty in Salt Lake County. We really have heart faculty throughout the state of Utah. So we have myself in Carbon and Emory. We have someone, Maren Wright Voss, in Salt Lake and Tooele. Gabrielle Mirza, who is in Utah County. Sadie Wild, who serves Ogden and Weber. And then Tim Cady, who serves the upper part of the state in Bear River and Cache counties. Okay. And so we were strategically placed in those small areas because of the substance use rates and the overdose deaths that they were experiencing in 2018. And we've made a difference, right? Things have been going down, but we're still higher in Carbon and Emory than the state.
Right.
That was a really good question.
Yeah. We have another really good question from Teresa. She says, where can we take old meds in Salt Lake County? This is a great question. I mean, for anyone in the state, if you have old medications, we know the wrong ways to get rid of them. You shouldn't throw them away. You shouldn't flush them down the toilet or put them down the sink. I know you said that there's a National Take Back Day, but what are options throughout the year for people who have old meds to discard?
This is so great. I love these off the cuff questions. This is so fun. So people can discard medications any time of the year. Most pharmacies can take them. Hospitals often have a Dropbox, or probably the best place and the most trusted. It's all confidential, all anonymous. You can take them to local law enforcement and drop them off. Many of them have a Dropbox, and fire departments often have a Dropbox. I think it's always helpful to look up the Take Back Day or the Take Back website, and I can try to find that really quickly while we're talking. But there's a website for all of Utah that has a list of all of their Take Back locations.
Oh, that's great.
Yes, and throughout.
Teresa, I won't make you look it up right now, Ashley. I'll respond to your comment with that link because that's great. And Ashley, we maybe should have you come back and we can do a whole, things to know about the opioid epidemic, because I feel like I've even heard, so I sometimes work in the Salt Lake County Extension office, and, I've heard people talking, like after you guys did like a conference or a summit or something a few years ago, and talking about like, oh, like if you have, young people in your life, whether they're children or grandchildren, here are some warning signs to look for and things like that I think would be so helpful. So maybe we'll have you come back and we can talk about
I would love
those.
that. Yes. Yeah.
Okay. Oh, Teresa followed up with, when is the National Take Back Day? Do you know?
Yes. This month, April 30th from 10 to 2.
Okay. Perfect. All right. Well, I have lots of links I need to share in the comments now, but this was so great. Ashley, thank you so much. It was great to get to meet you and talk with you and learn a little bit more about the Heart Initiative and all the great things that you are doing. I appreciate it.
Thank you, Marta. Can I share one more thing that we have coming up?
Absolutely.
We also do Be Epic, Escape the Vape is one of the things that we're doing in rural Utah in Carbon, Emory, and Grand. So we have an upcoming webinar for parents and guardians in Grand County on April 5th, which is next Tuesday, coming very soon. And then we also have a statewide one because people were so interested in, like you mentioned, right, signs in youth to look for and things that we can do for prevention. And I mentioned that tobacco and vape are kind of a gateway substance, and prevention is prevention. So if parents come to this webinar or guardians, they can learn different ways to help prevent other substance use too. Right. And so the statewide webinar is May 10th. That's a Tuesday. And I can also send you, more links. One more link to put in for Be Epic, which is again another extension website, extension.usu.edu/Be Epic. So I'll send that to you too.
Yeah, we will post all of those links in the comments. If you did join late and you want to hear the whole conversation that Ashley and I had, this video will be, saved and posted. You can come back and start from the beginning. And don't forget to come back and look for those links for the Heart website, the Be Epic website, and webinar information. What else? The Take Back Day in your counties, but also, throughout the state, and as well as Ashley's contact information if you're in Carbon and Emory County and want to reach out to her, get involved with the coalition, all that good stuff. All right. Well, I think we'll wrap it up. Thank you so much, Ashley. It was, again, great to get to know you, and I hope we can have you back soon. I'd love to learn more and talk with you again.
Let's do it. I love that.
All right. All right. Well, I hope you all watching have a great Friday and a great rest of your weekend. Thanks so much. We'll see you next time.
Happy April 1st.